Okay, go on.
Hello, I'm Dr. Michael Madani, a cardiothoracic surgeon at UC San Diego Health, specializing in treatment of CTEPH.
Hello, I am Dr. Nick Kim, a pulmonologist at UC San Diego Health. I specialize in CTEPH treatment. In this video, we will answer questions you may have about CTEPH.
What is chronic thromboembolic pulmonary hypertension and how does it develop? Well, CTEPH stands for chronic thromboembolic pulmonary hypertension. Commonly, how this happens is that patients will experience a pulmonary embolic event, meaning clot will get dislodged from part of the body and gets trapped into the lungs. And in vast majority of patients, if that happens and they get adequate treatment, those acute clots will resolve. But in subgroup of patients, and we estimate that it's about 3 to 5% of those patients, the clots actually do not dissolve and do not go away. And over time, they become chronic scar tissue that become completely adherent to the pulmonary vessels and cause obstruction.
How is CTEPH different from other forms of pulmonary hypertension? This is actually a very good question because there are some forms of pulmonary hypertension or many forms where there is no effective treatment. However, with CTEPH, if properly identified and referred to an expert center, you can have a curative treatment. What symptoms do patients experience before their CTEPH diagnosis? Just about all our patients with CTEPH have shortness of breath, especially with exertion. Oftentimes it can go undetected or unrecognized for months and maybe even years. The patients will also at times have fatigue and chest discomfort. How does the condition impact a patient's daily life before treatment? Our patients' daily lives can be dramatically impacted. They may not be able to work because they're short of breath with minimal activities. They're not able to engage in normal activities like spending time with friends or going out because, again, these patients are quite symptomatic. Any little activity can make them short of breath, sometimes have chest pain and dizziness.
Why is it often misdiagnosed? Oh, this is such a great question. And the reason it gets misdiagnosed so often is because there are so many other causes for shortness of breath. And it used to be many years ago when we were starting with this disease, patients actually would get misdiagnosed for years. They get treated for being overweight, being obese, having asthma, having COPD, because the most common symptom of this disease is really shortness of breath. What can patients do if they suspect CTEPH? I think the most important thing is to really talk to your healthcare provider, especially if they've treated you for different conditions like asthma, obesity, weight loss, or COPD, but things are not getting better. And it's pretty easy. It starts with getting an echocardiogram to make sure there is nothing else going on in the heart. And if that's abnormal, then it leads to other imaging studies that can really diagnose the condition.
What would you say to someone newly diagnosed or unsure about seeking treatment? I know it may be scary to have a diagnosis of CTEPH at first, but recognize that this is a form of pulmonary hypertension that thankfully has very effective treatments. In fact, we have now multiple treatments. And so if you're referred to a CTEPH center, especially at expert centers like UC San Diego Health, the team of doctors will evaluate you and select the appropriate treatment for you.